Hi, welcome. I'm Dr. Bill Owens. Thank you so much for joining me today. I'm interested to go through a case with you using the SpineCAMP decision support tool. This is a pretty complex case that came to me not too long ago, and I'd love to share it with you and talk through what SpineCAMP has helped me to do clinically. This was a case that came to me in March of 2026. The original injury in her neck was actually in February of 2010. This was a work-related disc injury. And unfortunately, she had 4 surgeries here just due to non-union and non-healing. So we're not going to go super far into that. But what I want to share with you is she was sent to me for an evaluation for permanency under the workers' comp rules in New York State. So there's specific criteria that we have to follow. And 98% of the time, those opinions lead to some sort of deposition or court testimony on why I made the decision that I did. So evidence like x-rays, physical exam, history are important, but I always struggled with that final dot on the map. Like, we are here, the X that marks the treasure, right? This is the problem, and here's the tissue injury, and it's either going to get better or it's not. Now, in terms of the 2010 injury, this is the hardware. However, she was recently hurt in 2022, which was still 4 years ago. And her neck was the problem, as well as her low back, but it was superimposed on all of this. So again, my thought process is, where the heck do I start? This patient's standing in front of you, and now we have these x-rays, like, what's going on? So when we look at her motion, we can see that when she bends forward, all of her motion is at the shoulder, right? Cervical thoracic junction, or CT motion. 80% of her motion is cervical thoracic, obviously, because this is fused. When we see her extension, we could see that this is kind of stabilized here, and all of that motion looking up is distributed through only 2 vertebrae, not all 7 of them, right? So she's at a disadvantage because of that, but also because this is all fused. So when we do the AI-driven automated SpineCAMP analysis, it's lickety split. It's 60 seconds. It's accurate to sub-millimeter measurements. So in terms of my decision-making using this data, I can rely on it. And I'm relying on it virtually every week in my practice during testimony, whether that's a deposition or whether that's in court. This is about as defensible as you can get in our current environment. It's not opinion-based, right? The data is solid. So even though there was surgical hardware here and these disc spaces are fused, you can see how accurate the SpineCAMP measurements or geographic placement on the vertebrae actually is, right? And this is the tool that we need, because if it's inaccurate on the dot placement, right, or the geometry outline, well, the measurements are going to come out wrong. That's why it's so accurate, because of that validation. So let's take a look at where she's moving. And if we stabilize the entire spine in magenta and we move the C2 vertebrae on top of all of that, we could start to take a look. We could see her occiput and C1, and we could see how that's moving, right? We have a gap here. We have a gap here, as we should, right? She's rocking back and forth. But if we look at C2 and 3 in this interspace here, this starts to not look very good, right? It looks excessive. We could see the facet joint coming all the way up. We can see how it opens up. And my eye just goes there because, as I have mentioned in past cases, I'm learning from SpineCAMP to look. This green ellipses represents center of rotation. And as long as the orange dot is in the green circle, the center of rotation is within normal limits. It's obviously normal for this level because it's bolted into place, but we can see the motion and how much extra movement is there. If we go a little further down, this is the fused segment. Now, I'm showcasing this to you because I want you to understand that the point placement of SpineCAMP geometry in the area where the implant is really important, because not all implants heal. You can actually have motion within a fusion, and that's called a pseudoarthrosis. That is not a place that we adjust. It's a place that can often result in chronic long-term spinal pain. And we're going to look at the actual report on this. There's a little bit of movement. It's subtle, particularly in here. But let's move down a little bit farther. And we can start to see that a little bit of motion there. But here, pointing out an error in the radiology physics is this area of the spine should have had more penetration. So this KVP wasn't high enough to penetrate. We could see on one view, we could see C7, but we need T1, right? So SpineCAMP will actually outline what it can see, but it'll also tell us when it can't see. And here's the final look. Let's look at the report and see what it says. Now, when we look here, the red is the area that we know exceeds AMA thresholds, right? This is traditional textbook alteration of motion segment integrity, 25% whole body impairment. The gold is aligning me to visually to an area of her spine that's moving excessive, but it hasn't quite met that threshold. So it's outside of normal database limits, but it hasn't crept up to the level of AMA guides. We know C5, C6, right? Here, 10.7, we know AMA thresholds is 11 degrees. So very close, right? But you can see here, her range of motion is horrible in her neck. And we understand why her ligament injury is at C2-3. So if I take red and I come back up to C2-3, I can see, in fact, my visual hunch was sort of right. So looking at SpineCAMP helps me to know where to start. It helps me to articulate in a court of law where the true injury is, because this is what the jury sees. This is what the claims adjusters see. This is what the attorneys see. But the truth is, this is what SpineCAMP sees. And this is what I need in order to understand what I'm going to do to help this patient. So I hope that sheds some light on the power of this AI-driven decision support tool called SpineCAMP and how easy it is to use, but how insightful that can actually really be. Thank you so much for your time. I look forward to seeing you on the next case.